Recently, I come across this post from an Indian patient in a vitiligo Facebook group. This signifies the trauma of vitiligo. So, he tells that if everyone thinks butterflies and deer are beautiful due to white spots, then why not we? If the world is jealous of us, it gives both positivity and negativity there. So, first he he feels inferior, and in second question he feels that he is different. So, there are both things are there. So, there are a lot of stories in India due to psychosocial problem, but moral of every story is that vitiligo causes lot of cultural and social stigma. There are a lot of problems with that. Patients won't get jobs. There is problem in getting marriage. Even 50 plus patients, they seek treatment because their daughters or sons will get problem in getting married because of their parents' vitiligo. So, the situation is very different there, but I am not saying that suffering is less in US, because cultural differences are more, but the thing is the magnitude of problem is the same. The quality of the suffering may be different, but the quantity is same. So, vitiligo causes lot of psychological problems because of the cosmetic appearance, because the human tendency is to become normal. They have a obsession towards normalcy. That is the problem with our mindset. Brief this one introduction about my work. I have a clinic called melanocyte, named after melanocyte, which gives color to skin. It is based on New Delhi, India. I do exclusive vitiligo treatment and research. Then we have a comprehensive and holistic approach for vitiligo treatment. We have several advanced medical and surgical treatment options, and we follow a protocol called individualized interactive treatment. Individualized because every vitiligo patient is different, every vitiligo is different. So, treatment has to be individualized rather than generalized. So, I prefer an individualized approach in every aspect, in vitiligo support, vitiligo treatment, fighting with vitiligo or living with vitiligo. It has to be individualized rather than generalized. My vitiligo is not same as your vitiligo. That kind of attitude has to be there, because vitiligo comes with lot of variation of presentation. So, treatment, everything differs based on that. Just a simple explanation why one get vitiligo. There are a few reasons to it. Probable reason, first one is genetic susceptibility. I do not call it as genetic disorder or hereditary disorder. There is some kind of genetic susceptibility to get vitiligo at a cellular level, but just having this, nobody will get vitiligo. You need some triggering factors. Those triggering factors are like these three. One is increased production of free radical. This is kind of toxin which is produced even if take anything, any food, drinks, because it is when it metabolizes in body, you get a byproduct which is not desired, that is free radical. It may be due to lifestyle changes, lifestyle, environmental factors, stress, or there were some deficiencies and derangements, and along with that patient will have some decreased neutralization of these free radical. In a normal individual, the free radical, even if produced, it will be neutralized. They will have deficient neutralization because of certain deficiencies like vitamin B12 deficiencies. They have a decreased free radical scavenging. Because of this, cells are getting damaged, because melanocytes are very sensitive to this free radical damage, and this is the genetic susceptibility basically. The melanocyte cannot fight that extra free radical presence. Next comes immune system. Everybody says vitiligo is autoimmune disease, but autoimmunity is the fourth step. It is not the first step in vitiligo causation. The reason for autoimmunity is most of the vitiligo patient I am treating, we do vitiligo vitamin D level checking, and most of them are having low vitamin D level. Most of the individuals in nowadays are vitamin D deficient, but vitiligo with vitamin D is very important, because vitamin D basically manages immune system. Either it prevents normalcy of maintains normalcy of immune system. There are people say that even in melanoma people will have vitamin D deficiency. I would like to say that in melanoma immune system is hypoactive, and in vitiligo whereas it is hyperactive. So, vitamin D is basically brings normalcy in immune system. When if vitamin D is also deficient, you have a hyperactive immune system which does not tolerate damaged cell. There is one thing, like person who is suffering from melanoma won't get vitiligo, and person having vitiligo won't get melanoma. It is proven also. It is related to this level, like if there is any damaged cell, abnormal cell, the immune system of vitiligo patient does not tolerate that, does not allow the cells to accumulate as it happens in melanoma. So, it just destructs the cells, and over the time it just do not destruct abnormal cells, it target normal cells also. In future what happens, like normal cell might become abnormal, better to remove that in that principle. So, you will get vitiligo. This is the like simple explanation for vitiligo, any type of vitiligo, this is the basis. Then how to correct this? Genetic susceptibility nobody can treat, because it is what you have got, it is there. But we have seen patients getting vitiligo after 40, after 50, we have like people say it is hereditary. We get patients like children having vitiligo, and after some time parents having vitiligo. If it is genetic or hereditary, parents should get it first, then children will get it. It is because of genetic susceptibility. It can come anytime, and genetic susceptibility becomes important only if you have these triggering factors. So, you can keep this genetic susceptibility dormant by removing these triggers. First is free radical production. You can decrease the free radical production by lifestyle interventions, diet modification, then stress management. There are some skin care techniques, and managing all those deficiencies. Important deficiencies are vitamin B12 and vitamin D. If you maintain normalcy in that, if I prefer like in vitiligo, you want more than normal, not just normal, it is more than normal in vitamin D and vitamin B12. If you maintain that, the chances of repigmentation, chances of maintaining that is high. Then decreasing free radical neutralization by some nutritional supplement, like you know about antioxidants. You can take antioxidants like vitamin B12, I prefer vitamin B12. Vitamin C is one of the other antioxidant, but it has a controversial role in vitiligo, so I do not prefer that. Then having a normal vitamin D level. If you have a normal vitamin D level, you will have normal immune system, and if you have still immune cells against your cells, here you need short course of immunosuppressive. It is not a permanent like long term intervention, it is a short duration, small dose to take care of this. By the time this will be effective, these will be effective, so that you will get a vitiligo free like time. But with this intervention you may not get repigmentation in every lesions which had happened already. With this approach I see patients do not get new patches, and recent patches 2 to 3 months old patches get pigmented without any intervention. You do not need any light therapy, you do not need any stimulating agents, they just achieve spontaneous repigmentation. That is why I stress early detection and early treatments. Without much intervention you can fight vitiligo. I do my treatment in 4 phases. First I concentrate on arresting the disease, stabilizing the disease. Next you can achieve pigmentation via medication. Then there are certain kind of vitiligo, so in some vitiligo they respond to medical management, after some time they stop responding, because medical management depends on reservoir. You have to have some cell reservoir in the patch. If you have cell reservoir there, you can stimulate it. If you do not have it, we call it as refractory phase. Tons of medication will not work there. Whatever medication you take, whatever race you take, they do not respond. There what we have to do is replacement, replenishment. We have to put the cells which are lost. I do a treatment called cell transplantation, where I do replace the cells and they respond, most of the patients respond with that kind of treatment. And you see this middle phase, which is like common to every phases, it is maintenance phase. You have to have supportive measures like lifestyle changes, dietary changes, skin care interventions. Then you have to have a positive mindset, because too much stress with the vitiligo may not help you, it will just worsen your disease, which I will explain later. Then you have to understand some of the patients with segmental vitiligo or who had taken a lot of treatment and now they are not responding. You have to understand the puzzle of vitiligo. Vitiligo has two different problems. First, you will get depigmentation, you will get more and more white patches. After some time, what happens? You do not get white patch, but that white patch is not response. Whatever you do, it do not respond. So, you will slowly going into a repigmentation disorder, where getting color is a problem. You do not get color because your skin, where you have white patch, do not want color back, because it had adapted without living without those color bearing cells. But your mind does not accept that, because your skin is normal, but the appearance is not normal. So, you want color, but the skin does not want color. It is not, you will not get any skin cancer in vitiligo skin, but still you suffer, you are affected by vitiligo, not having any problem because of the cosmetic appearance. So, treatment has to target the present situation. If you are, as you said, she is getting new patch, so we should not try repigmentation, we have to stop depigmentation. Then we have to go for getting pigmentation, that is what that repigmentation does. What are all the medical management I do? One is active management, that is oral medication like immunosuppressives like corticosteroid, methotrexate, azathioprine. I am not using a medication which are not used here, they are regularly used here in a higher dose, more frequent dose. Why? Maybe like people are not, the practicing dermatologists are not going for this kind of treatment. At their end, they are not able to justify the need for it. But if you consider the magnitude of problem and the suffering patients having, especially in India, like even here they are suffering, it is a lifestyle altering disease. So, there is some justification to go for this kind of treatment, because a child suffering from vitiligo has more problem than child suffering from atopic dermatitis, because you give all the right treatment, they are treatment free, and it may not be visibly like bothering them, but they are getting this, but the child with vitiligo is not getting it. And what happens in a child? There will be children in school, they question a lot, and because the normalcy starts from childhood. Obsession with normalcy, children getting affected in their schooling, they do not, they become introvert, they do not socialize. These things can be tackled, a simple measure, maybe 3 to 6 months. In children who are coming to me for like a very early stage, the need for immunosuppression is for 3 to 6 months, that to very low dose, which are given as a daily dosage for more than 6 to 9 months for other condition. But that is like it has to change, and I hope Dr. Sulochana will definitely consider that, and she will change the mindset of fellow dermatologists here, because there is a need for such kind of treatment, because unless otherwise you halt the disease, you will not get repigmentation, because in this disease it is not the color, it is not the condition which loses color, it is the condition which is there because of those color. If they have color, they will get vitiligo. If you try to get only colors, you cannot help it. So, you have to have a system which targets that destruction of color bearing cell. Unless otherwise we do that, it won't help. It said that narrowband and any PUA will have some immunosuppressive action, but it is not that much sufficient to achieve, because it does both. It stimulates, it irritates, at the same time it does some immunomodulatory action, but it may not be sufficient. So, I prefer a low dose of short duration of immunosuppressive, which is right for that patient in that country, and topical, which is always there in US, corticosteroid, tacrolimus and all those things, but in my experience they may not work alone. You cannot even only tacrolimus cannot work single, this one you have to combine with the corticosteroid topical also, if smaller, very smaller lesion. And you need some supportive treatments like nutritional supplement, which I give vitamin D, vitamin B12, then copper, minerals, which will just support the previous one, and during longer duration, after 3 to 6 months, these are the only oral medication patient taking. You can just remove this one and continue this one, depending on, like I do testing every 3 to 6 months. If they have normal level, I do not supplement. If they have below normal level, I will go for the supplementation. Along with that, you have to have moisturizer, because dry skin gets more vitiligo, because dry skin means irritation, irritation means trauma, trauma means vitiligo. So, moisturization is very important. Sunscreen, they say there is this belief that if you go more in sun, you will get more pigment. It is not like that. If you are in an active disease, if you have active disease, simple sun exposure can be a trauma to you. It irritates your skin, you will get more white patches. Even if I advise patient to go for sun exposure in certain stages, that is guarded sun exposure for particular time, this one duration, then it is not daily, alternate days. You have to give breaks every other day, so that your skin adapts. There is a stimulation, then recovery, stimulation, recovery, then you will get pigmentation. Usually what patient do, they do not go for sun exposure. On weekend, half an hour, 1 hour sun exposure. Instead of helping them, it harms their skin. Then to achieve pigmentation, there are medications. In Delhi, in India, I use narrowband, that is also home based phototherapy. I promote home based phototherapy because clinic based phototherapy, the compliance is not that much good, because patient has to come every alternate day to particular place, they have to skip their work or schooling, there is a lot of expenditures, and it is long term treatment, 3 to 6 months minimum, and daily every other day, 12 to 15 days in a month. It is very difficult. So, people stop treatment after 1 month, 2 months, and they have this kind of treatment every 3-4 months, 1 month, and the skin gets adapted. They are not taking a regular treatment, it is infrequent and with regular intervals. Instead of giving improvement, their skin becomes adapted, skin becomes harder, it do not respond to usual dose of light therapy. So, I prefer home based therapy if patients has less than 30-40% of body surface area involved, and home based therapy with proper training, because it has to be patient has to be trained, and then it has to be done, and the results are very good. Even patient is traveling, they can carry that home unit, small units, and they can take it even their vacation, during vacations and all those things. So, there is no break in the exposure, and even night time they can expose to the narrowband, because there is no timing for that. Even you go for sun exposure, what happens, like particular time you have to expose the sun, and there is seasonal variations, you will not get the same quality of sunlight. Then if you go for a clinic based, this one they have some fixed working hours, you have to go during that hours, you cannot go at your convenient timing. So, with that home based
but you don't do that for stable, correct?
I do for stable vitiligo.
For stable, but if it's unstable?
Unstable, I stabilize the disease, then I go for home therapy. This is next stage, when I told about the stage based therapy. When first I stabilize, then I go for stimulation. If it fails, I go for cell transplantation. It is state based treatment. Then in India we use Soralens, but I do not prefer Soralen because it actually depletes the reservoir. If you have much of reservoir, it actually repigments. You have a limitation of reservoir, it actually depletes the reservoir. So I do not use these things, but I use these newer ones, prostaglandin analogs and beta fibroblast growth factor, which is available in India. They do not have any side effect, but they stimulate the cells. I use it along with the home based phototherapy units, and nowadays I do a process called micro needling, which comes in minute needles in a roller form, and patients who are not responding with just this kind of treatment, I do a session of derma roller or micro needling to stimulate those reservoir, and I continue with this treatment, and they tend to get the result. I am just showing few of the results. This is around 3 to 4 months after this just phototherapy and micro needling. Same patient. I am showing very few photos because I have to cut short my presentation. This is 72-year-old gentleman in whom I could not get give any aggressive treatment because of his comorbid condition. I treated him only with vitamin supplementation and phototherapy. This is the treatment, and he is usually coming from southern part of India to me, in northern part I am located, and he travels to for treatment every 3 months, because he has taking treatment for 50 years without any, and he is like in government, this one he is in a very high position. He retired from that. He was having like access to every kind of treatment, but he could not get the treatment result, and he started this kind of treatment, this vitamins and light therapy. This is the result, and he is now 90% covered, and only some fingers patches are left, and it is also pigmenting, and he is now forcing me for surgical treatment, which is like in 72 I have to consider. If it is on the other parts, I would have taken him for procedure, but fingers it is like it takes a lot of time to recover, but now we are working on that hollow micro needles and to deliver the cell. Maybe he will be the candidate for that kind of treatment. This is on the scalp. Actually, this patient was referred by the first patient. He is also working in that ministry, and he recommended this patient, and this is the treatment. And this patient had diabetes, hypertension, hyperlipidemia. So, I could not give any other medication, only vitamin D supplementation. Pigmentation with surgical management. Why we do surgical management? There is something called refractory phase, which I am telling. There is no reservoir. It is characterized by white hairs and no hairs like fingers. Then you tend to have dark borders and islands of pigmentations, which do not progress with the repeated treatment. These are the candidates for cell transplantation, which is fortunately started in Emory. Maybe in next few months, I think it might be a treatment of choice in US for segmental vitiligo. It is just a replenishment of cells. You have to understand that I am not targeting any underlying cause. Cells are not there, I am putting them back. The problem is, if your disease gets activated from inside, the cells which I transplanted, they may also die one day, but chances are only 10 to 20%. Most of the patient, if we choose for surgical management, they are having stable vitiligo for some time, and having unstable vitiligo in them is rare, unless otherwise they are too negligent, then they will have unstable vitiligo. I do there are a lot of surgical transplant methods, but I prefer cellular transplantation because of the efficacy and advantages associated with that, because you can treat large area, the color match is near complete, near perfect. I do offer 3 kinds of cellular transplantation. One is called non-cultured epidermal cell suspension, which is I am transplanting your own skin cells I transplant non-cultured follicular cell suspension. I prepare suspension out of your hair follicle, hair root, then transplant, and newer one combined cell transplantation. I combine both. Now, non-cultured epidermal cell suspension transplantation is available in Emory, and it is going to be officially available maybe few months later. These are the pictures. This patient, this is a classical segmental vitiligo. Patient was taking treatment for 15-20 years, no result. This just after 6 months. Another patient. In this patient, you can see, like, because of the light you cannot appreciate, she has lot of white hairs here, and after the treatment her white hairs decreased, very few white hairs are there. In this process, what happens, after skin repigmentation, your white hairs also get repigmented. But unfortunately, this procedure cannot be used for premature graying, because when I say this, people even my mother asks, what you can do anything for this my graying of hair. So it cannot be done, but this is for gray hairs in the subset of vitiligo. Another patch, eyelid, both eyelids treated. I treated large area in single sitting, and this is the result. 6 months after, patient got married. That is the end result. It is, I am not telling about this result, I am telling about that result. That is the actually desired result. This is the one thing called bilateral segmental vitiligo, very large area treated in single sitting. This is the, and you are seeing before and after picture, but the importance is the journey. I am not able to show the journey, because journey is not every time before and after. There will be some deviation. My expertise experience during last 8 years to bring every unsatisfactory result into satisfactory path. So, you will achieve this with interventions, and sometimes surgical management is not the exclusive management. You may have to take medical managements like vitamin supplementation, narrow band to stimulate the cells. So, it is not exclusive treatment, it is mutually related treatments. Role of diet, I get lot of questions, so what is the magic diet for vitiligo? There is no magic diet, but there is a role of dietary modifications. Restriction is important, because I see a lot of patients who are like not eating vitamin C food forever, not touching white food forever, not drinking milk and milk products forever, but still not getting any improvement. And I have patients who are doing all those things, like taking all those things and still having stable vitiligo. So, diet is specific to patient, specific to vitiligo, specific to stage. So, the rule of diet is moderation, balanced diet and nutritious diet. Whatever you want, you like you are like 25-year-old patient comes to me with vitiligo, I say stop this, stop this, stop this, don't have this. He is taking a certain diet for 25 years, and overnight I am asking him to stop everything. I do not think that it is effective. So, better, like instead of taking too much, you have a moderation, you have restriction. It is self like controlled rather than imposed by someone else. In India, we see a lot of patients taking treatment out of frustration. They do not know what is vitiligo, they do not want to know how they get pigment. There are advertisements saying that you get pigment within 3 days. They go for that, they apply the solution, they got burning blisters like that, because they want result. They don't know, they don't want to know how they get it. If somebody says don't eat this, they don't touch it for their lifetime. And I have seen one patient who are like somebody of her known took ginger and get rid of vitiligo, and parents of this child, they gave only ginger to her, in everything ginger, and she landed up with liver failure. This is what happens there. So, there is no too good food or too bad food. So, it is just a moderation, everything bits and pieces they work, but they do not work alone. if you don't take treatment, if you do only manage diet, you may not get problem, you may not get improvement, or you take all the bad food, you won't get overnight your skin becoming white, it won't happen like that. So, in diet you have to have moderation, because in social media, in my patient group, this is the main thing, diet. They want magic diet, they want diet which pigments the skin, they want diet which like stops the disease. No, we do not have it. It is mixture of everything, and you have to follow a pattern of diet. So, nowadays I have seen especially some profession where they do not have breakfast, they do not have lunch, they have mega dinner. This is what most of the patient they are having this problem, and at very young age 25-30 they have cholesterol abnormalities because of that, and cholesterol abnormality is related to vitiligo. Basically you are active in during day times and you need energy during that time, and you do not take food, you will be starved, you will be like under stress, once again free radical will come, and you get energy through conversion. The body stored this one energy resource will be converted and you get energy, and that process you get free radical. Next you take mega dinner, heavy dinner, which is not needed, because after that you are going for rest. You do not need those energies, it will be stored as reserve, and conversion. Conversion means more free radical. You will be following all the diet recommendation I had told, but there is no pattern, no use. I have seen most of the patient, especially people who are working in software industry, they have their odd working hours, they follow everything, they take medicine, they take narrowband, everything, but result is not good. So, this is one of the reason, because you are constantly producing more toxins which are like important in vitiligo. Next, another question in vitiligo, stress and vitiligo. Yes, one of the main reason for vitiligo or aggravating vitiligo is your stress. Why stress causes vitiligo? As I said in my that graphical explanation, stress really increases the production of free radicals. It is like you have vitiligo, you have stress because of vitiligo, more stress, more free radical, more vitiligo. It is like a vicious circle, and usually I tell my patient that you expect me to treat your vitiligo, you expect because of that your stress will decrease and you will become fine. No, it is not like that. You take less stress, my treatment begins to respond and you will be fine with your condition. Solution is within. It is not like from my side. Most of the vitiligo patient who are coming to me, they go through like somebody recommends me, they go through the website. I tell them like you forget everything. It is not me who is going to treat you, it is you are going to treat it. Because my treatment is like a tool. It is just a tool, like my treatment or any kind of treatment, whether it is phototherapy or anything, it is a tool. There are only 4 possibilities are there. You use it properly, you will get result. You use it wrongly, you don't you get wrong result. You don't use it, you don't get result. And there is 4th possibility. There is always fate. I am not the everything. You do everything right, you may not get good result. You don't follow anything, but still you will get result. But that chances are very less. But in every aspect, the common thing is not the treatment, that is you, that is the patient. Patient has to be involved in fighting vitiligo. The treatment don't just give result. It is importance should be given to the patient who is using that treatment. I tell them like you come to me, you take treatment and you have this much of previous prescription, and after 3 months you go to 3 months you go to another doctor and mine is on above that. That should not happen. I will tell in the next slides. This is very important, living with vitiligo, because I see a lot of Facebook pages, I am member of lot of vitiligo groups, but I am little bit worried about the negativity there. Recently I got a patient from Vancouver, child suffering from small vitiligo patches over the fingers, and her mother is thinking of committing suicide because of going through all those negative like posts about vitiligo. She has a stable vitiligo for long, almost 2 years, and they are spending like anything to get rid of that. I told, don't overdo it. Look, she has very limited disease, and if she last 2 years she didn't get more vitiligo, so the chances are very less, because in vitiligo you have to understand one thing: the body fights. Body keeps on fighting, whether you take treatment or not, body fights to normalize, because it tends to normalize vitiligo. If early stages, the chances are more, because sometimes it is said in India that vitiligo is self-limiting disorder. You don't, even if you don't take treatment, it might repigment one day. It happens in some patients. So, you cannot generalize the agony. If I am suffering from vitiligo, I have some problem, the other patient need not suffer like that, because there are kind of vitiligo, there are types of vitiligo. They might be having hidden patches, they might be having segmental vitiligos. The patient with segmental vitiligo need not suffer the trauma of generalized vitiligo. There is one thing called triage in medical practice, in emergency practice, where you group the patient with their severity and attend according to that their severity. So, we have to have a triage in vitiligo. You group vitiligo patient according to their type, severity, stage, you treat them. If I am not saying that a vitiligo treatment is effective in every patient. There are patients like who is like by choice, who don't want a treatment. Why to force them? They are fine with their vitiligo. I don't prefer to force them. I get lot of Indian Americans who are like born and brought up here, coming to me. Their parents are like forcing for the treatment, but the child is comfortable with that. So, I advise like he is comfortable, why to force? So, if it is by choice, definitely they should be encouraged, and if they have extensive vitiligo, especially if they tried all sort of treatment or no treatment, it is extensive and the fighting part cannot work there, definitely we should give support to live with vitiligo. Then if they are comfortable with vitiligo and they are not actually affected, means they might be having patches, but they are not affected by it. So, why to like take medicine? So, they can live with that, but I am not expert in that. US has lot of vitiligo support groups. In India, unfortunately, we don't have support groups. Even we have, it is like bits and pieces. But in US, very good support group basis is there, and Natasha is working on vitiligo bond, which is also very like coming up like anything. So, these kind of patient you can give support, but at the expense of like somebody has this kind of vitiligo, we cannot expect the other patient who can have vitiligo which is treatable, like the patients we treated other day, like their suffering is they still have more suffering, because they have patch over face. So, person who is having extensive patch over the trunk and it is covered, he may not be having any problem, but a small patch over face, it gives lot of problem. The severity is not decided by the extent of vitiligo, it is decided by where it is located. Then living with vitiligo should not be due to lack of awareness about the effective treatment. So, we have to like as I said to Natasha other day, we have to spread the awareness ki the effective treatment can happen, and there is a generalized assumption even in India that vitiligo cannot be treated. I am not telling that every vitiligo is treated, but majority of vitiligo patient can be treated with kind of like facilities we have got now. But somebody is asking for cure, like this is the one thing, like I forgot to add the cure thing. Look, how many diseases we have got cure so far? How many diseases? I don't know. Means I mean like medical practice since last 15 years. I don't know. We had thought ki maybe there are 26 diseases which we can have cure. All other diseases like this is just you are out of it and you maintain it. Even the common flu, you are not cured by common flu. you just passed, you had get like recovered from one episode, you might get common flu again with other virus. So, it is not cure. So, the most of patient coming to me, whether it is curable, whether if you write it in document that I cure the disease, then only I go for treatment. How many diseases have got cure? No. Diabetes, hypertension, thyroid problem, no, they do not have cure. So, the cure psychosis has to be removed. Get rid of it, maintain it. Even in diabetes, you control your sugars with lifestyle, treatment will decrease, will be minimal. It is you who can cure it, not the treatment or doctor can cure it. Even in vitiligo, it is you. The sufferer can cure it, not the doctor. So, if you follow instruction, follow a certain lifestyle, you will cure it. Next, what are the reasons for fighting vitiligo? Last like few years of my private practice in medical management, around 80% are complete or satisfactory result. I am not saying all are complete. Satisfactory means you have to go by plan A, plan B, plan C. Plan A does not work, plan B does not work, plan C. If you do not get complete repigmentation, you have to try for repigmentation of larger patch, visible patch or treatable patch. So, that kind of approach has to be there. Next, surgical management, if selected properly, I am getting 90% results, satisfactory results. And one more big truth is childhood vitiligo, starting treatment at early age, more than 90% of. I get lot of patients with 4 years old, 5-year-old, you may not need even immunosuppressives, just supplement, supportive care. Your patient, the child is, I have seen like 5 years back, I had seen child, now they are coming once in 6 months without any new patch. The thing is, any like visible dryness or patch, they come to me because they are very conscious about that. They take care of their skin, and it may not be 90-95%, it may not be vitiligo patch. So, in childhood it can be treated, and these are the vitiligo. I was telling Natasha that these are the candidates, the early vitiligo, starting vitiligo. We have to like, I understand every vitiligo patient has to be treated or taken care of or supported. I am concerned about this new entrants, freshers, because we can do a lot for them compared to already established vitiligo patient. So, because I want to target that patients, even in India I have that approach. New patients are, because they are the one like we can do some intervention properly, and in established patient, they are basically modified patients. They have taken lot of treatment, lot of they have misconceptions, everything developed because of the experience they had. Because most of the patient, what they do, they assess the new treatment because as based on their previous bad treatments. So, when that happens, you won't, you will be like, I will try this, if it won't work, it is not the first time for me, I will go for another thing. So, they never like stick to one place, they will just wander around, and I tell them, first what do you do is take the baggage, put it outside. You want to run 100-meter race, that is fine, but you want to run that 100-meter race with 50 kilogram of weight. How can you like do that? It cannot be like done in the same timing. It is more like exhaustive and all those things. So, the baggage of your previous treatment, previous bad experience, whatever frustration, keep it out. Understand what doctor is offering you, why that is for you, how it works, what are all the pros and cons about the disease, then it works for you. Factor for a good outcome, individualized approach, as I said, then motivated sufferer with realistic expectation. Motivation is very important, and involvement to fight vitiligo. I get lot of patients, children where they are not involved, they are overprotected. Parents are forcing them for treatment, it may not work. If the child goes for a higher education and he just suddenly stops everything because he do not want treatment. So, this is one thing. Then early detection and early treatment, then target based vitiligo type and stage based treatment as I explained previously, regular in follow ups, sufficient treatment duration. I have seen patients who are like they want result overnight. You lose pigment over the 3 to 4 weeks time. You don't, because it is scientifically you lose 3 to 4 weeks time. If damage happens now, the new skin comes, during that time the melanocyte is not there, no color is given. So, that time your white patch is visible. Recovery takes the same minimum that time to get visible pigmentation. But what happens, they start treatment, daily mirror, no improvement, nothing can happen, because overnight nothing can happen. So, there should be some sufficient duration to get the result. In generalized vitiligo, the duration can vary from 6 months to 2 years. The treatment varies, the duration, total duration varies from 6 months to 2 years. Next, maintenance. If you get a better result, you maintain it. I had told about maintain supportive care and all those things. And what is the bad outcome factors? Generalized approach, every vitiligo is treated same way. Treatment out of frustration, like patients seek treatment out of frustration, they don't want to listen, like they don't, doesn't matter how the treatment works, why that treatment is given to them. Unrealistic expectation. I have seen patients like patch, I have seen one patch where one dot is left. They never focus on the 99%, they will tell that one dot. It is not, yes, anything less than 100% is failure for patient, but as a doctor, I am not everything, I am not God, because I cannot give 100% every time. Any treatment or any like doctor, not just me, any doctor cannot give 100%. You have to have a realistic expectations. In every other disease, you may not have same this one result. And one more thing, like maybe like a distance, like you have a 50 miles of distance, you cover it by with 2 hours or like that. Sunny day, better weather, no problem, you cover it same path with same mode of transport. If it is raining, if it is snowing, you cannot travel, means you cannot cover it with 2 hours, it might take longer time. So, the main aim is to get the destination, not about like when I will get it, why I stuck at this point. So, that kind of thing happens in vitiligo treatment. They are more concerned about the transient periods. They just close eye, they will be at, when they open the eye, they will be at destination. That is the expectation. So, if you have that expectation, that is very difficult. Then either too many treatment as happens in India, or no treatment as happens here. So, both are not good. Treatment started in advanced stages. You start a particular treatment, actually it works in early stage. If you start it in advanced stage, it may not work. Frequent treatment changes, as I said, they keep on do doctor shopping or treatment shopping. There are nowadays you have a lot of options for online. So, that is a problem, and there is no maintenance phase. Once they get the color, they do not maintain it, then you do not get the result. So, last time I had shown this pyramid where I said vitiligo will go. The basis is that the large majority of the group can be completely treated. Then there will be treatment patients who like have most repigmentation with some residual patches, and small subset of patients who are suffering from segmental vitiligo and focal vitiligo, they can be completely treated. And this one, like we cannot offer much treatment. Living with vitiligo is for them, and all others can fight vitiligo, and living and fighting are not mutually exclusive, they are go hand in hand. But nowadays what happens, this is down, this group is up in the tip, but actually there is a lot of hope for vitiligo patients. What is the take home message? Significant number of vitiligo are treatable, either medical mode, by medical mode, surgical mode, or both modes. treatment and its response varies according to type, size, site, and it needs involvement. Role of supportive measures like nutritional supplement, healthy lifestyle, being positive and healthy diet, they are important. You have to understand the vitiligo, its treatment and its response. Unless otherwise you understand it, you won't get the result. And there is no magic with logic, without logic. So, everybody expects magic, but it cannot happen without logic. For more information, you can go through these websites, and also Dr. Sulochana is there. Emory, they will be going for the vitiligo clinic. So, you can get much better information. But problem with me, I cannot offer any treatment to US patient because I am not allowed to do that. I can only counsel you, I can guide you for the right person who can treat you, and I can like advise you regarding what is best, what is like going to work for you, but I cannot actually prescribe it. Thanks for patience hearing.
I do. The surgical treatment, is that specifically for segmental vitiligo?
Surgical treatments are not specific for segmental. It is done for every stable vitiligo. You need to have a stability. Stability means you should not get new patch during last 6 months to 1 year, not increase in the size of the patch last 1 year to 6 months, or you should not get a patch at the site of any trauma or friction during last 1 year. So, any kind of vitiligo can be treated, but at Emory we are treating only segmental vitiligo, because segmental vitiligo is the best candidates. They get up to 100% result, and the color match is so dramatic that no need to apply any concealing makeup. It is normal skin they are getting, normal color they are getting. Even generalized vitiligo can be treated if they are stable, any area. I have to stabilize you, that is what I am telling. I have to stabilize you, because it is a phase based treatment. First I stabilize you, I try medication, the kind of lesions you have got. I see a lot of medical management hope there, because it will repigment if you arrest the disease. If after 6 months or 9 months you do not respond to medical management, at the same time you do not get new patch, then we can do cell transplantation.
With me, mine's come as stress, and it's just only in my face, and it just goes away, and I don't have the light patches, I have the dark patches, and it comes like freckles. And then how I determine when they're going to be dissolving is that they get larger, and that's when I notice that they are gone. But it only flare up like the month of June. Everything was fine, and mostly my body is all clear. And then June, when I do an event or something, family reunion, and I guess that stress is on, you're working and want to make everything go well. But it's the dark spot. When I first started in 2002, I had a white spot, but they always be dark. Mine's dark. So.
You are better candidate for depigmentation. One of the problem with depigmentation, the facial area, because as I said, body always fights to get pigment, because you are naturally like your genetic this one makeup is to get the pigment, because you need pigment. So, during summer times you tend to get speckled appearance during the summers because of the that property. One of the thing you can do is like use high this one SPF factor sunscreen covering both your UVB and UVA. That could be one of the option, because this thing like there is with depigmentation it is not always 100%, because you tend to get speckled pigmentation every time, because your normalcy is to get the pigment. You are like choosing a treatment which removes the treatment, but your skin needs pigment. So, best way apply, because the reason why it needs pigment to protect from the sunlight, the sun rays, UV rays. So, use high SPF sunscreen, that might solve your purpose.
Are there any therapies on the horizon for people with long-term widespread vitiligo, so people with over 80% of the body coverage?
Usually in that area, like if depends on the place they belong to, ethnical group they belong to. In India, still I treat them because they want repigmentation. I do treat with them with all these the steps. But in US, if they are like comfortable with the depigmentation process, they can go for depigmentation. But if it is not treated much, there are chance for repigmentation, there is a hope for repigmentation. But they cannot get complete, but if they are fine with that plan B, get like majority of the areas covered, some residual areas, it can be done.
Okay, I noticed in here that you mentioned autoimmune diseases, and my daughter is the one that I came here for because she has it. And hers, I guess, has been started about 10 years ago when she was working in the sun a lot at that point in time. But you mentioned the autoimmune. Our family is covered in autoimmune diseases. Does she have a greater chance? Like I have osteoarthritis, her grandfather had rheumatoid, we all have thyroid issues. I mean, is her chance of actually being successfully treated less than because of all these other autoimmune issues?
Not exactly, because vitiligo we see a lot of autoimmune issues, if not in patient, it will be in family, there will be history, and most common autoimmune disorder is autoimmune thyroiditis. But if you treat that part like autoimmune thyroiditis properly with thyroxine, and they will respond. Without treatment that might worsen, that is a fact, because with the autoimmune disorder, if you do not intervene, definitely it might worsen. If you do not take care of your thyroid, definitely it will worsen, because in females and in India with vitiligo, females they tend to have more of autoimmune thyroiditis. Around 20% of patients I see increased TSH levels, that thyroid stimulating hormone.
We're trying to take care of all the autoimmune issues, and you know, with me, with treatment for that, and then thyroid or whatever. But like I said, it's basically on both. She's got it on both sides of her family. So I wondered if that would make her more prone to this.
But the difference is, like in other autoimmune, rheumatoid arthritis or other autoimmune disorders, the immunosuppressive the dose duration that might be very like large or very strong, but whereas in vitiligo it is lesser compared to those diseases. That is what I am telling. There are a lot of other diseases we are actually aggressively treating, but we are not treating vitiligo, saying that it is a condition, it is not life threatening, but it is life altering. Sometimes life threatening, because I get patients, they say, if I say that melanoma and vitiligo, they say I prefer melanoma because at least I die with it. I do not have to fight vitiligo, I do not have to face the society, because life altering, living with vitiligo, fighting every day becomes difficult. So, that becomes the basis for aggressive treatment for vitiligo.
Can you overdose on B12?
B12, vitamin B12.
If you're taking 8,000% of the
like usual dose of vitamin B12 is like 1500 microgram. The normal level is 200 to 900 pg, and even if it becomes 1500, hyper vitamin B12 is not a problem usually, but whereas vitamin D you have to maintain a level below the upper limit, because there is always a problem with hypervitamin D. If you have more vitamin D also problem, but vitamin B12 not a problem, because if it is higher 1500, if I stop that, because it depletes quickly, the vitamin B12 depletes quickly. So, you do not have any health hazard with more of vitamin B12, but it is advisable to test your vitamins at least once in 6 months. If it is too much, you can stop for some time. And it is one of the important vitamin to fight your vitiligo, because it is a major vitamin which targets free radical damage.
I have a question. Are you familiar with Caroline LaPoule's?
Yeah, that HSP 70.
Yeah. Where is that?
It is in too early stage, because the problem with like all mouse models, and I was discussing in Sulochana about another study where simvastatin working in vitiligo, they had some mouse model basis for that. Mouse is not replicating human skin. The my skin is not as same as human skin. It is like they don't have epidermal pigmentation. So, any study done in that may not be useful in human, but it might be useful, but it takes lot of time. It might take lot of time, but it might work in only autoimmune part. All other reasons are there to get to vitiligo, so it don't solve that. So, both, like it might be good, it may not work.
Yeah, thank you everybody for coming. Okay, and we have refreshments outside. Feel free to go ahead. And if you have any more questions, feel free to talk to Dr. Holla or Dr. Fruman.
The best, because there are two ways to contact me. One is like I had shown the websites. Then you can send a query. I am planning to start Google Hangouts or Skype consultation, but once again I tell I cannot prescribe anything. I can suggest, I can counsel, because I get lot of patients from US and UK that just counseling part works wonders for them, because they don't know anything about vitiligo. They come to know about vitiligo after that counseling, because if you understand vitiligo and you understand why the treatment works and how it works, then definitely it is helpful to fight it. And another thing is like Emory is coming out with the vitiligo clinic possibly sometime later. Dr. Sulochana is associated with me since last 3 years, so you can consult her for the treatment.